Good evening. Welcome. My name is Katina Kearney Edwards from School Readiness Consulting, and on behalf of the Kresge Foundation and Detroit Public Television, we welcome you this evening to Tools for Hope learning session on trauma and mental health. The Tools of Hope professional development series are led by Detroit-based organizations with deep experience serving children and families. The 10-session series began back in August and continues through December 10th. Each session will provide Detroit's early childhood education professionals with tools and information as they continue to support children and families through the COVID-19 pandemic. Before we get started with this learning session, we like to take care of a few housekeeping items. So first, to reduce background noise, all participants are muted. We're going to use the chat feature tonight to communicate throughout this session. If you look at the bottom of your Zoom screen, there's a button for chat, and clicking that button will open up the chat box. You can send a message to me or the facilitation team by typing in a message and pressing enter. Right now, I am going to send you a welcome message just so you can see it. This evening, this format is a little different from the series in the past few months if you've attended those. We're going to start with a panel where they're going to answer a series of questions, and then we're going to be followed by an experiential learning segment, and then transition to live Q&A to conclude our time. As a reminder, if you have a question for the panelists, please type it into the chat box. Without further ado, I would like to introduce Joy James. She's the moderator for this evening, and she's representing our partners, Kresge Foundation. Joy?
Thank you so much, Katina. As Katina shared, my name is Joy James, and I'm a program fellow with the Kresge Foundation, and I'm so honored to engage with you all in this important conversation about mental health and trauma and how we support the hearts and minds of the children that you work with, but not only them, but yourselves as educators. And I'd like to introduce our panelists, our lovely panelists that I'm honored to be joined by. Christina Grimm, Director of Clinical and Trauma Services at Starfish Family Services. Kate Rosenblum, Clinical and Developmental Psychologist at Zero to Thrive at University of Michigan. Sarah Campbell, Early Childhood Educator with Starfish Family Services. And Andrea Rogers, Clinical Manager of the Early Childhood Behavioral Health Programs at the Children's Center and Infant Mental Health Clinical Mentor. So I'd love to start the conversation by just, passing the mic over to you all for about 30 seconds if you'd like to share a little bit about your role and your organization. Maybe we can start with you, Christina.
Sure. Welcome, everybody. We're excited to offer this series here and this segment. I work at Starfish. I've worked there for probably just under 20 years at this point. And my passion has been for the last 11 years focusing on trauma and bringing our agency to a level of being trauma informed as well as bringing it to the community. So we are excited to be a part of this initiative and here to help everybody on this to learn and hear more about trauma and what we can do.
Thank you so much, Christina. Kate, if you'd like to share a little bit about yourself.
Absolutely. Thank you. It's so good to be here. Hello, everyone. Delighted. I'm Kate Rosenblum. I'm a clinical and developmental psychologist by training and a professor of psychiatry at the University of Michigan, where I direct a program called Zero to Thrive, which is focused on promoting the health and well-being of children and families through a variety of different programs and initiatives. And I'll just add, I'm a mom of kids, living also through the pandemic in different ways, passionate about infants and toddlers and young kids and their families and the people who support them, because I think that's the most important work that a person can do. So I'm just really excited to be here to learn and to have a conversation together. Thanks.
Thanks so much, Kate. And Sarah?
Everyone, I am an infant toddler teacher at Starfish Family Services. I've been teaching in early childhood for about 9 years now. I'm working on my master's degree right now at U of M Dearborn in early childhood education, special education inclusion. At Starfish, we've been really getting focused on being trauma informed and working with children and helping them children who have experienced trauma. So I'm really excited to be able to share some of the things that we've learned with you today.
Thanks so much, Kate. And Andrea?
Hi, everybody. Good evening. I'm a clinical manager here at the Children's Center of Wayne County. I work in early childhood behavioral health, where we are super excited about all things for children 0 to 6. So whether that's their parent, their caretaker, their teacher, we want to support advocacy and training and just anything that makes that introductory years that much better. And what we know about the time that we're living in is that, there's lots of questions, there's lots of feelings that surrounding that. And we really want to help support that with parents, teachers, and family members alike. So I'm very excited to be a part of this conversation today.
Thank you so much. And maybe we'll start with you, Andrea, with our first question, really thinking about the impact of COVID-19 and the social injustices that continue to persist in our country. How are you all thinking about supporting the mental health of your youth and really nurturing the resilience with all of the fear and anxiety that might exist and be, of course, overwhelming?
One of the first reactions as parents and caretakers and anyone who loves little ones is we want to protect them. And right now, with so much going on, that need to protect and the lack of information can be frustrating. So one of the things that we suggest is to have the conversation just at a basic level, asking them, what are you seeing? What are you thinking? What are you feeling? Because what we know about children is that they make sense of things in their head and they put it together, even if they're not discussing it. Because sometimes we can say, well, they haven't talked about it. I don't know if this is, affecting them. We want to be the givers of information and accurate information. And being honest when we don't have that information is also very, very important. But the things that are going on disproportionately affect the communities that we serve. So it's a conversation that we have to have.
Can I just jump in and underscore? Because I just love what you shared, Andrea. And I was thinking it's so important with little people that we recognize that they actually are affected by experiences around us. And I think, this is true for preschoolers, it's true for infants and toddlers. It's like very little people can be affected by trauma, grief, and loss. And I was thinking about a presentation I did not too long ago where I had a conversation then with a teacher who was saying, I found that message both painful and hopeful because, it's hard to open up your sort of heart and mind to the fact that very little people can be struggling with this. But it's hopeful because once we see it, we can do something to let them know they're not alone, to let them know that we care, to help them to feel secure and protected by us in the ways that we can, and that we're there with them, that we have their back, and that we're going to provide them the nurture and the relationship and the stability that's going to help buffer them from some of these hard experiences. So I just think opening that door is really, really critical.
Thank you both so much. It's extremely important that we, communicate both, what is going on, but also ensuring that the children know that we are there for them as well. So thank you both for sharing that. And Andrea, you touched on this a little bit when you shared that, the communities that we serve are disproportionately impacted by the current moment, which is a very important thing to think through. And I was wondering if Christina and Sarah, if you have any examples or tips as to how early childhood professionals can be proactive and provide a learning environment that's really centered around racial equity and trauma and being trauma informed, and how that may look like now that we're in this virtual space.
Sure. So Sarah, I guess I'll start and then hand it off to you. Is that okay? All right. So I think number one is that we need to uphold the unique value and the dignity for each child and family that's coming in our doors, and recognize that they all come into us with unique strengths, They have differences, and we need to embrace those strengths and differences. And one of the biggest things is just developing that trusting relationship, especially if they've experienced trauma. We know that they're in need of trusting relationships. So making sure that we develop that. And from an early childhood education perspective, making sure that we're setting up challenging but yet achievable goals for each child. So trying to make them as child-centered as possible. I know it can be hard when you have, classrooms full of little children running around, but trying to make them as child-focused as they could, and for that unique child. So let Sarah take it from there.
Absolutely, Christina. So as Christina said, building those relationships is really, really important for both supporting children and having a racially equitable classroom and through children with trauma. Building relationships with not only the child, but the family as well. It's really important to learn about the family's culture and the kind of things that they do at home. In the past, I will ask families to bring in, empty food boxes or things like that to include in our house area, so children see things that they eat at home represented in the classroom. We try to have pictures of non-stereotypical roles in the classroom. So, a female construction worker, an African-American doctor or lawyer, things that children don't typically are exposed to in the big real world. Also having books with people of color as the main character. And then as far as trauma goes, it's really important to make your classroom a safe space, so that children know that it's safe and they can trust you and they can open up to you, and just forming those relationships so that when they are having a hard time, they feel comfortable talking to you about it and you can support them through it.
Sorry, can I just jump in here one more time? Sarah, can you bring up what we talked about earlier today regarding the virtual classroom?
Yes, thank you for reminding me, Christina. So I was telling Christina earlier, during our virtual learning, we're creating what are called storyboards. So it's kind of like a lesson plan and a newsletter rolled into one. And they include pictures of the activities that we're asking the families to do at home with their children. So when Starfish did a training on implicit bias earlier in the year, it really made us aware of making sure we're including all of the children's backgrounds in those photos. And it was actually really frustrating that Google is incredibly whitewashed, and you have to really put in keywords to get inclusive photos. You might just Google stuff and then realize, all 5 of your pictures are white kids. So we're really being intentional about that now that we've been made aware of it, to make sure everyone feels included.
Would it be okay if I jumped in here? I love those ideas. And I was thinking, that one of the things I really appreciate about this conversation is that we know that experiences of loss, of grief, and of trauma are actually not equitably distributed. And that while we're all in this together, we're not necessarily all having the same experience. And where there's disproportionality in the experience, addressing trauma, loss, and grief is actually an issue of equity. It's about responding to kids in a way that gives them what they need in order to be able to optimize their developmental potential, their learning, their growth, to be, the person that they can and, should be. And so really addressing these things is part of really ensuring educational equity and health equity for little people. So I'm just delighted that we're having this conversation, because I think that's really, really critical.
Extremely. Thank you so much for sharing that. And thank you, Sarah and Christina, for sharing those tips, especially the virtual storyboard. I think that's really interesting, and being intentional about, what are the photos that you might be using in those virtual storyboards. I think that's something that's incredibly important to think about. I want to shift gears a little bit and thinking about you all as educators and those out there as educators that are joining us. And if you all could share any tips, whoever would like to start, maybe you, Sarah, as to how you manage or balance your mental health and stress during this time. Has it changed your daily routine? What do you think has really helped you during this time? And what might you give as tips to other educators and professionals out there to support their mental health?
Absolutely. So, as I'm sure everyone has experienced, this pandemic has greatly changed my daily routine. Some things it makes it a little easier, some things it makes it a little more difficult. I know having about a 10-second commute to work has been very nice. But in the same breath, working from home can be challenging because I find have a hard time putting my work down at the end of the day. When you have all your work stuff there, it's hard to not reply to that email at 7:30, 8 o'clock at night. So definitely trying to make sure I'm not working outside of work hours as much as I can, since my workspace and my relaxing space are now the same space. I've also found activities that I enjoy to do. I've actually picked up sewing during the pandemic. It started as mask making, but I found that I really enjoy it. So that's been a nice relaxing activity. Obviously, watching streaming services has been huge. Um, Also, having a support network is really important. I've been spending time with my parents as much as I can at their cottage, which has been nice and relaxing. And then my co-teacher and I have a really good relationship where if one of us is feeling extremely overwhelmed or stressed out with everything going on, like we'll pause on what we're doing that day and talk about it until we feel better. Or one of us will pick up a little bit extra of the share of work so the other person doesn't feel quite as overwhelmed. So I think that's been really important too.
Thanks, Sarah. Does anybody else want to share any tips as to how they've been managing or balancing their self-care during this time?
Sure,
I
I'll
can
go.
jump in.
Oh, go ahead,
Oh.
Andy. Go ahead.
Oh, okay. I was about to say, I'm definitely not an expert. It's a learn it as we go kind of experience. Because what I figured out is like all of my usual stuff is so face-to-face in connection. So I had to kind of be creative. One of the things I've recommitted to my exercise and self-care, I realized that I definitely have less stress and tension when I exercise. So not that helps with, if there's any extra snacking that's going on. But it's a chance for me to have some activity with my daughter, that's fun because now we're doing the virtual learning thing. Making sure that I'm eating better and eating healthy. Just because those are some of the things that I can control. And Sarah mentioned it, but that connection and that community, having that support system is so important, and being intentional about checking in on them and checking in when I need something as well, being able to have that space. Because as educators and mental health professionals and bosses and everything, mommies and clinicians, we hold so much. It's very important for us to model those things for our staff, for our children, and for our families.
Thanks, Andrea. And Christina, seems like you also wanted to share some tips.
Yeah, I just think that, well, what Andrea and Sarah had said, and I'm going to be relying on Sarah to do some sewing for me because I am not a sewer at all, nor will I probably ever be. But I do enjoy crafting, so I try to find different tips. I have a Cricut machine, so I, make different things and keeps me busy and it's fun. But outside of that, I think it's just relying on coworkers for support when and if I can. We have started slowly opening back up, so I am able to kind of go into the office every now and then and just see people even at a distance. And that's really helped me feel connected again because I miss that part of it. Although I'm more of an introvert, this has taught me that I still need to be with people. And so being around people, I get excited. And sometimes I even go in for a hug and then I have to remember, like, wait a minute, this is COVID time. I can't do that, or or they'll do the same thing. So it's remembering that I still need those connections, and trying to, connect with family out of state even by utilizing Zoom. I think um, what the pandemic has taught many of us is that we can be creative and use technology in a different way to connect with people, and schedule more time with loved ones that we just don't always get. So it's kind of taught us that, and then using some of the free apps. So Headspace, and I think I have it part of my presentation later, but Headspace was offering free during the pandemic for persons that were in helping professions. So we definitely started doing that, and then Starfish took it a second step and actually now have paid for a subscription for all of our employees, because we're seeing so much. We're seeing so much loss. We have a lot of death that's happening due to the pandemic, and trying to support our staff in any way we can. And that's just one step that we knew that we could take, even if it's to help our staff start their day or end their day by using some kind of a calming app.
Thank you all so much. You've given me some tips that I need to use, but I really just appreciate the comments about leaning on your network, leaning on each other, and your other educators or folks in this space, or even family, to support you through this time. Andrea, I've definitely been snacking extra, so exercising and being active, especially as we're probably spending more time sitting at our desk. So definitely appreciate you all for sharing that. So I just wanted to maybe wrap up the panel with just one last question, circling back to youth in this space. And I just want to invite folks, as they think of questions, please feel free to use the chat to send them to us, as we'll have a Q&A portion a little bit later after the presentation. But some folks ask, around when it might be appropriate to recommend additional services to assist with mental health and trauma, and if there are any indicators that you as educators and administrators might be aware of that educators can keep an eye out.
It always takes me a second to get to the mute button. So I think, and Kate, you can jump in here as well, but I think it's just watching for changes in behavior is part of it. And then watching for the severity of those changes, or the length of time. So typically, if a change has happened longer than a month, that's more of a concern. It's not just something that's short term going to go away. So just watching for that, and if they're having a lot of difficulty functioning in the classroom, paying close attention to that. And then again, that severe depression, anxiety, or even being emotionally blunted. Those are always of concern. So just paying close attention to them. And again, if it lasts longer than a month, make a connection to even to your local community mental health agency, and partner with the parents as well, so that you can know, is this going on at home as well.
Yeah, I think those are all great things to look for. And I think, you know the kids, and so you know what's expectable and what's not, and to, really attend to that. And in the presentation, I'll share a few sort of behaviors that we often see, but I was going to just underscore one of the last points that you made, Christina, that, you also have this really critical role in families' lives. I mean, parents trust teachers, and parents are struggling. And so I'd be listening to and attending to what parents are sharing, how they're looking, how are they doing? Because we know that kids, little ones don't exist in a vacuum. They're in families, and their families might be struggling. And when we see that that might be going on, we can help to make connections and facilitate, access to care in ways that can really have a positive effect on both parents and kids. So really seeing the whole family.
Thank you so much, Kate. I just want to invite Andrea and Sarah if there are any final comments, of course, before we switch to our next portion of the presentation by Christina and Kate.
I just wanted to piggyback, of course, the things that Christina and Kate said are so important. I'm one of those, I'd rather have a bigger reaction than needed than to look back and notice that I underreacted. And so we keep talking about intentional conversations, but when you keep those conversations going with families, you see the opportunities where stress levels are increasing. They're speaking of, sleep is up or down or mood levels. And so just based upon those conversations, when we see something, we want to have, some type of intervention or interaction with that family. So we can say, hey, like everyone needs some level of support right now. And so, I'd rather us offer it early than to kind of wait, you know what I mean? Because the pressure of everything, all the things that we've talked about, racial trauma, COVID, stress, just everything. We all need to know that someone cares. And hey, something seems a little bit different. You want to explore that, or, do you need some help with that? Maybe we can find some resources. So when you see those changes, definitely having a conversation.
Thank you so much. It's really important, as you shared, Christina, and all of you shared, really thinking about how have those behaviors changed, and if there's, a significant duration, making sure that you're able to connect with the family and the child to understand, more of I'm here for you, and how might we be able to support these behavior changes. Well, thank you so much to the panel. And again, I just encourage you all watching and joining in to be able to share any questions that you might have in the chat, as we'll be switching from this panel discussion to a presentation by Christina and Kate to share some activities and helpful tips that can support you, yourselves as educators, as well as your young ones that you work with. So I'll pass it over to Christina and Kate.
Thank you. Just give me a second to share my screen.
Thanks, Christina.
All right, we good, Kate?
I think we're good. I think we can move forward through some of these early slides. Okay, so I think I'm going to launch us now with talking about how we might help infants and toddlers and young kids cope with stress, trauma, grief, and loss. And we've already started that conversation. So I'm looking forward to hopefully underscoring some things that you've already been thinking about and doing, and just giving you that validation that that's exactly right. And maybe we can brainstorm some new ideas together too. So next slide. I just wanted to start with that point that I said earlier, that even very young kids can experience stress and trauma and grief. And, this can be overlooked sometimes even by really well-intentioned, well-meaning adults, maybe because it is hard to see, kind of like the teacher I told you about before. But once we do open that door, it really allows us to acknowledge children's experiences and give them the support that they need to be able to cope and stay healthy, even in the face of the adversities. So as teachers, kids so well, and they're really, depending on the adults around them to be able to be the detectives for what's the meaning behind the behavior. So this is especially important with young kids, as you know, because young kids often don't tell us, but show us their feelings and what they need. And then we're sort of trying to figure out, based on the behavior, what is it that you need? And how can I meet that need? How can I sort of see you and respond to you in a way that helps? And really what that is about is shifting away from like, why are you doing this, to what do you need from me? Like, what do you need? And how can I support you with that? So next slide. So there are a lot of things that we might be watching for, and we just talked about that. And here are just a few sort of examples of things that we do often see in young kids who have experienced traumatic events or have experienced a loss. And it's important to know that kids don't have to have directly experienced that, but they also can be impacted by the fact that those events affect people around them. And so they're sort of sharing in that experience. So we're sort of just looking for the ways in which kids might be showing us that they're having big feelings that might be overwhelming and they need help with. And that could include increased crying or inconsolability. For that, we might not want to wait too many weeks, right? Like that's sort of, Andrea, your point, like you don't want to wait too long. You want to get in and support right away. Like how can we help you with that? Changes in regulatory behaviors like sleeping and feeding, or changes in developmental skills that kids used to have, like potty training, toilet training skills. Kids who are more silent or withdrawn, that can sometimes be harder to see, but is such an important signal that kids aren't feeling sort of ready or able to connect, to be socially engaged, and that could really be telling us something about their feelings. When they're hurting themselves or hurting other kids, acting out, being aggressive, fearfulness, being easily startled, or just times where they sort of check out and you just sort of don't know what's going on there with that. And then a big one that I think we see a lot of times as early childhood, specialists, is that when kids are dealing with big feelings, they might have more difficulty with transitions, and maybe especially with things like separation from parents, or you're seeing big feelings on separation or reunion from others. But really, any other changes that you might notice about a child's typical behavior is something that you want to attend to, and better to approach it and be curious and think about how you can respond than not. So next slide. What I really wish kids could do in some ways is walk around with like a little thought bubble above their head that sort of said, what you see is that I'm hitting, or what you see is that, I'm doing these things. But what I really need you to know is that I'm feeling so overwhelmed and I just don't know what to do with these big feelings. And when I feel overwhelmed or stressed, I can't hear you. I can't think clearly. I can't respond to you. And what I really, really need is for you to help me feel calmer and to feel safe. And I will just add, I wish that I could have that thought bubble above my head sometimes. And I bet every single teacher or early care and education provider here on this call probably has moments where it would be helpful to have that bubble above your head too. Like, we all need that sometimes. So we just want to think about how can we help kids feel calm and feel safe. Next slide. Well, the good news is, and this has been the theme already, is that in fact, there are things we can do. Relationships are the foundation of resilience. And resilience can really bring back health and hope, even in the face of adversity. So next slide. So what is resilience? Resilience does not mean that things are easy, that they don't affect you, that you don't have hard feelings, that you're not still struggling. That would be unrealistic given the hard things that children and families are dealing with. But what it really means is that we're giving children what they need in order for them to be healthy and hopeful, even after or as bad things are happening. And kids can experience challenges and still be resilient. That means they can get back to the work of childhood, playing, learning, connecting, learning to trusting in adults, exploring new things. So research has told us that if caregivers can provide a safe environment, it can really help in a nurturing environment. It can help to build resilience that reduces the effect of trauma and stress. I think of it as sort of a protective buffer. And it doesn't mean that things might not be hard on the outside, but it really helps to sort of protect the child from that adversity. Next slide. So how do we do this in the classroom? Well, I think, honestly, I'm so excited to have the panel here because there are people here who can share this from their experience. Sarah, I'd love to hear more from you too about this, but I'll share some thoughts, what I've learned from providers and what I know about little kids. The first is watching, noticing for changes in behavior, things that are happening that you might want to address. The second is providing consistent and predictable routines. School actually, the opportunity to be in the setting with you may be one of the most sort of consistent, predictable, safe experiences that young kids have, and it's so important. And I'll just underscore something here. We don't always even need to know what's happening in the child's life in order to be helpful, right? So if we see changes in behavior, even if we don't know why, we can still do things that help them to feel safer, better, and more secure. Providing those kinds of consistent, predictable routines lets kids feel reassured, reduces their stress, and lets them sort of fall into something that is more comfortable. Then sort of thinking about giving kids choice and opportunities is important always. Like, I bet all of you are thinking about that always, but I just want to point out that that maybe is even more important at a time when kids are feeling such a loss of control, when kids don't feel that things are understandable or predictable, giving them those opportunities to have choice, to have control really helps to bolster their resilience. And then to pay attention to, acknowledge, and validate feelings. It is maybe important to say, you know, I can't let you hit Johnny, but but being mad, I understand. It looks like, I wonder if you're feeling mad. So it's okay to have feelings, but I'm going to be here to help you keep the feelings safe. Next slide. And then I'm a big believer in thinking about how do we sort of help with the feelings. So I was just going to share a couple of ideas. One is the use of stories, and stories can be used in lots and lots of different ways. But when we tell stories that capture aspects of what kids are thinking about or feeling or experiencing, it lets them know that you are recognizing what they might be feeling, that it's okay to have feelings. They can feel understood, and they can also understand more. And I'll share some more about books and resources that you can use to help support that sort of dialogue with young kids. Next, to really let kids know it's okay to express emotions, and that you're going to help them keep it safe. The next one, we're going to talk a little bit. I know Christina has some, I have some. We're going to sort of share these different techniques and strategies. And I want to underscore, it can be so helpful to do this during low stress time. So practicing and introducing those in the classroom at times when everyone's doing well makes it easier to sort of say when things are hard, hey, you know how we did that belly breathing? Why don't we give that a try right now, right? But you've practiced it already. So building that into your routine can be a really powerful way to bring it up when maybe the situation calls for it. And then thinking about how to nurture, extra nurture. Kids just need all that extra nurture, loving right now to get through this time. So thinking about time ends and, really working at our best to be calm, present, and patient. On that note, just one sort of added point, I was thinking about what do we do as professionals to care for ourselves? And I was thinking one of the things that I hope we can all do is practice some compassion for ourselves. We're not always going to get it right? But we're going to do the best we can. And it's okay that when we try, we don't have to be perfect to be helpful. Okay, so next slide. So I said I'd share some resources about stories and play. I mean, one thing is just make it up. It's fun to tell stories. You can have stories about a little kid who's, maybe a little bit more removed, and maybe you can make up a story about Joey the turtle who likes to hide in his shell when he's feeling, overwhelmed, and, have some conversation about Joey the turtle. It helps keep it safe for kids to have it told in a story form, but believe me, when there's something that they're resonating to, it's going to mean something to them, and they're processing it in very deep ways often. So we're letting them know, hey, you know what, Joey the turtle is hiding, but I'm noticing Joey. I know that he might be hiding because he's having feelings, and what could we do to help Joey feel, better in this situation? Then there are different examples that you can download, like at Zero to Thrive, we wrote a children's story and coloring book called Georgie and the Giant Germ that you can download, and it's in 7 different languages, and it's free. There's another book on Piplo Productions called Trinket and Sam that has lots of pages that you can print out that tell experiences related to COVID. And you can just use the ones that make sense for the kids that you're sort of reading to, and not the others, right? You can tailor it. It's also free and available. And then, the videos on DPTV, Sesame Street and Community's website, Daniel Tiger, like those are all stories that help kids feel seen, understood, and find ways to cope. Next. Okay, and then I was talking about different activities that you can do. So mindfulness activities, I think, are so important right now because we're all feeling the stress. And these kinds of activities really help soothe the nervous system, help kids calm, and they can be playful and fun, empowering. At the end of the day, I think all of us, what we need to do is breathe through this sometimes, right? Like just to slow down. I'm realizing even when I'm talking and I'm like, oh, a deep breath probably would be a good thing. So we're going to practice that together in a moment. But here are some examples, blowing bubbles. And we call this box breathing. So there are different things that you can access. Also, we have that on the resource list for this Tools for Hope website. So there are different things that you can download and access and try out in the classroom and see what works. Next slide. With that in mind, I told you we were going to practice. I think it might be nice for all of us to take a moment and to have some fun, be playful, and breathe. And so this is a video that you can access, an Elmo video with Common. And I invite you all to just get comfortable in your seats, relax your shoulders. And if you don't mind, Christina, we'll watch this video together. Oh. Christina, I think you might have to unmute maybe. Thanks, Christina. I think we might have had a little, it's so fun, isn't it? It's like so great. And I think it might have been a little hard to hear, but I hope that you might find this on the resource page and listen to it because it's fun and energetic, and you can pull it up and share it with a kid and, you know, breathe together through it and really transform to chill the inner monster out a little bit in a moment of need. So next slide. And then also on the resource list is a link to different kinds of activity cards. So sometimes, you know, a fun activating thing like Elmo is just the thing. At other times, maybe things that help really sort of calm and slow things down might be helpful. So we've developed a bunch of cards that might help you to sort of think about ways to do that. So focusing like a flamingo, where you can sit quietly and practice a skill where you focus on 5 things that you can see, 4 things you can feel, 3 things you can hear, and you really help guide kids through that experience. Next slide. Or other animal cards. Roar like a lion, get on all fours, deep breath in through your nose, and then open your mouth as big as you can and roar like a lion. So lots of different animal cards with activities and skills that can help you to make it fun, but practice, you know, things that we know actually soothe and calm the nervous system. Next. So I just am going to stop here. I want to hope that we'll have more time in Q&A and share ideas, and that you'll share with one another in the chat box ideas that you have for how you help kids to calm. But I mostly just want to say, checking in on emotions is in fact as important as checking in on heartbeats. And I think the work you do is the most important thing. So thank you for the very important work that you do.
Thank you, Kate. That was great. The video really made me smile, and that was actually the first time I've seen it, so I thought it was great, and I found myself breathing with it, right? So it was great. And now we're going to kind of switch gears a little bit here, but what you're going to find is, although I'm saying I'm focused on staff, what you're going to hear from me is going to kind of mimic. Oops, sorry. It's going to mimic a lot of what Kate already had said. Because when we're talking about trauma, we're talking about stress and mental health, many of the same concepts go from children through adulthood. So you might hear some repetitive things, which is fine because that's how we're going to learn. The more times we hear things, the more we actually embed it into our brain. So one thing we would like to encourage you is to put on your trauma lens. It means recognizing that we don't often know what's going on with another person's life, and that those unknown factors may be impacting their behavior. It encourages us to validate the feelings of either the child or the adult that we're with, and ask how we can help rather than reacting to what may be perhaps irritating or off-putting behavior. We shift our perspective to from what's wrong with this child to what might have actually happened to this child. So kind of switching the way that we're looking at behaviors. We're really thinking about the need underneath the specific behavior exhibited by a child. If we can meet the need over time, the behavior will reduce in intensity and duration. And developing a trauma lens, just so you all know, does take time. It is a process. It is not a quick fix. And it requires all of us as individuals and within the organizations we work with to make a commitment to create and infuse trauma-informed practices. I want you to kind of think of these sunglasses as universal precautions, just as a nurse would do or a doctor. They put on these universal precautions like gloves or masks, not knowing that somebody that they're going in to see has a transmittable disease, but they're trying to protect themselves. So if we look at this as a trauma lens, as a universal precaution, that we're not looking at the person next to us or across the table from us, knowing that they had a trauma, but we're looking at them through that trauma lens to say, what may have happened to this person and how can I empathize with this person? So in a trauma-informed approach, what we really want to look at is what are the behaviors? How is their behavior helping them promote survival? So many times when we're seeing behaviors, we know that that's out of necessity to survive, especially if they are experiencing trauma or have experienced trauma. So what we see is when it's attention seeking, they're actually seeking connection. They need some sort of connection, which I know Kate had mentioned at that point with the children in the classroom as well. If we're noticing some manipulative behaviors, I don't really like that word for children, but we know people use it. That is them showing us that they have an inability to trust and that we need to try to build that trusting relationship with them. Also, we have the disruptive behaviors, and that's really the child asking that they have difficulty asking for help. So they're acting out in a way. And then we have inattentive. And so those are the worried and preoccupied behaviors that we're seeing. And as you can imagine that although I'm saying child, it's interchangeable with staff and child because we all have those moments too. We also have those staff who, some people might look at and be like, well, they're manipulating the situation. Not really. They just don't trust right at that moment who they're in front of. So traumatic beliefs can develop for children based on their experience of the world. These beliefs can get reinforced and contribute to symptoms present in mental health diagnoses. So again, we see that as the children even get older, we're continuing to see their behaviors increase if we're not addressing them at a young age. And then same with adulthood, we need to understand what's underneath the surface, what's really going on. So imagine again, putting on the trauma lens in those sunglasses. So a study conducted in 2010 with preschoolers had found that between a third and a half of all preschoolers at least had one traumatic event occur. And we also know through the ACEs study, so that's the Adverse Childhood Experiences study, that trauma is the most serious public health threat right now and has been for a number of years. And what they found in this study is that there is a dose relationship that is predictable. So that meant that the higher the ACEs score, so the higher of the adverse experiences that each adult had in their lifetime, increase the number of health problems that they exhibited as adults. And so that's why it's really important as early childhood education professionals, as well as for us, that we're looking at trauma and trying to help with their, just as Kate said, that they're building their resilience, helping them through their trauma. Sorry, my throat is really dry today. I'm gonna apologize. So at Starfish, we actually implemented it's called Trauma Smart. It's through Crittenton, and we use the brain as a car. We find that having a common language has really helped all of our staff really be able to connect with each other. So we all know that the brain is very difficult to understand, and we needed to find a way that we can all understand what we're talking about and reference the brain. So with the car analogy here, the trunk represents the brainstem. And what that brainstem really is those fight, flight, or freeze moments. So you can't really, focus on anything. You're in survival mode. This for children may look like huge meltdowns. It could look like aggression or running away. It could even look that way in staff. We also see acts of violence when somebody may be in the trunk. A person in their trunk following a traumatic experience, or if they've been triggered by an especially stressful memory or event, are not in the place where they can hear what we're saying to them, or in a thinking brain. So at this point, what we need to do when we notice these behaviors is provide safety. That's essential for them to come out of the trunk. They need a calm, quiet, and gentle reassurance that their physical and emotional safety is going to be supported or can be supported in that. And the idea for that is to get them out of the trunk. They can't really do anything if they're in the trunk and the trunk is closed. The next is moving up in the car, you move to the back seat. The back seat is our midbrain or the amygdala. And this is where our emotions are stored and our memories are stored. And probably Kate would have been the better one to explain all the brain stuff, because I'm not a brain person, but I like this analogy because I can completely understand it all. But it's a good way to visualize the backseat brain. And you may be able to think of a child on a long road trip who's stuck in the backseat of the car. And, they might be whiny and a little hyper, distractible, really excited one second and then bored the next, frustrated and irritated, right? So they're all in their emotion. They're not really in their thinking brain at that point. So in the back seat, what we're looking at is we're really looking to support someone in their back seat. Connection in the back seat is the key ingredient there. Connection may look like a close physical proximity, or it could just be validating their emotions and seeking to understand the experience that they have. Now, the front seat is where we as professionals like to think we're always at, but it's not always true, but we like to think we're there. So the front seat is our frontal lobes of the brain. This is our thinking part. This is where we have higher levels of functioning, like problem solving, impulse control, language, as well as judgment. So if we're in the front seat of the car, we can see where we're going, we can see what we're doing, we can take in all the information that's coming at us. The need in the front seat of the car is actually stimulation, looking for learning opportunities, and being engaged. It is important to know, though, that for early childhood educators, the front seat really is not developed until it starts developing between the ages of 3 and 5, and then it continues to develop until we're into our 30s. So it's always growing, it's always learning. So we can't necessarily expect our little ones to be in that part of the brain. So how can we help? It can be difficult to know how to respond when someone is experiencing strong or negative emotions. We often don't know what to say and can feel pressure to fix things. By being with them, we can emphasize what their experience and validate their emotional experience without judgment. Being there to hear their experience and validating their emotions is what people need in order to move to the front seat, where we can identify solutions with them, not for them. Building consistency, which is exactly what Kate talked about, is essential for creating an environment that is safe and predictable. When we know what is coming during our day, we tend to have less anxiety and we feel less chaotic, we feel consistent. We can actually feel like we can move throughout our day without any issues. If we don't do this, and the same goes for the children, let's say I come in and I'm expecting to go to a meeting, for example, and I walk in the room and I'm the only one in there. And then I find out 10 minutes later that the meeting room had been changed, the time had been changed. You know, my brain now is at least in the backseat and maybe trying to crawl into the trunk, because that just set me off a different way, right? Because I am that type of person, and many of us are, where we need to have consistency, we need to know what to expect and make sure that we're following through with that. So that's just, you know, wanted to give you one example of how, as coworkers, that's really important for us to make sure we're identifying for each other and keeping up with that. It's important to have routines. Having consistent routines sets everyone up for their success. Children thrive on routine. They may not always like that we're giving them a routine, but that we know that they thrive on that because they know what to expect. And then rituals. So rituals help us build connection and community. Think about your family traditions. Think about a special handshake that you have with a friend or a family loved one. Think about how I want you to take a minute and just think about how in your workplace do you welcome new colleagues or new classmates into your space. Think about from your team, are you welcoming? And what would a new employee say about the culture of your team when they first join? Can they detect these rituals? Can they do they feel that supportive community and belonging? Because that's really what employees and our coworkers are really looking for. As many of us were saying about self-care, we were talking about that connection piece. And that's important. And we want to make sure that we have that for all new people coming into our place of our organizations and feeling that support by one another. If you can't say that your place of employment is set up that way, I encourage you to figure out how you can be that change and how you can make those suggestions to do that. So we all know that our trauma histories play a large part in who we are today. It's who we have become. It's who we have, or what we've overcome, and what we're still dealing with. So what's important for us while working in these organizations and in the field that we're in is to know our triggers. Make sure we're aware of our triggers. Make sure that we know what buttons some of the children that we're serving can push and why. And what can we do to make sure that we get out of those triggers? And how can we lean on someone? So what again, going back to what Kate had said, is really practicing self-care and practicing it in the times of when you're not stressed is going to build in that muscle memory. It's going to build in that you'll already know how to react to something when you're in that moment, when you're moving into that backseat or in the trunk. It's going to help you automatically go there. We want to turn in those moments of relaxation. We want to turn those on almost automatically for you. You need to make sure that you communicate with your support system. This could be a coworker, this could be your supervisor, who would know some of your triggers, or it could even be your best friend, and you could be venting to your best friend on your way home or whatever it may be. Somebody who can be there to help understand where you're coming from and help pull you out of that trunk or back seat, right? Ideally, what we're aiming for is to get you back into the front seat as quickly and safely as possible. It's also very important for you to develop your own self-care plan. Self-care, I think has many, people think of it in many different ways, right? So a lot of people think of, I don't have money for a massage this week, or can't go on that beautiful, relaxing vacation that I want to take. Well, I can't do it either. I mean, and right now we're all stuck, right? We're all kind of halfway in quarantine still. But really what self-care is identifying daily practices that you can prioritize in your life to help your well-being. It's not about getting out, spending money, and doing something. And many people think that that's what it is, and it's not. It's about what can you do to help take care of yourself. And I can't remember who put it in the chat, but they had a whole list of things in the chat box just now of all their hidden talents that was really impressive. So that is self-care. Also recognizing secondary traumatic stress. So as we're talking about trauma, and we know that the children and the families we serve, as well as ourselves, we know that people have experienced trauma. And especially if I'm asking you to look at the children that you're serving through a trauma lens, you may be exposed to secondary traumatic stress. You're going to hear the stories. You're going to see the behaviors. So recognizing and knowing how to get out of that is going to be extremely helpful for you. This is one of the occupational hazards of being in the helping profession. So one of the self-report assessments is the ProQOL, sorry. And that is something that some people tend to use either for themselves, excuse me, or within supervision. Some choose to share that within their supervision and can rely on each other as a trusted space. Many infant mental health folks, they go through reflective supervision, and so they have that safe space. I hope that you all have something very similar that you can say that you can rely on. Seeking supervision in your work is key. I know that we all have coworkers and peers that we can rely on, but supervisors do have a different lens and can help in various ways. Sometimes when we rely on a coworker, we get stuck, right? So we ruminate on the situation. Supervisors can tend to help us get out of that. So making sure that we're using supervision in that way. Again, talking about self-care. I want to also mention, I know that we try to push for people to take their paid time off. I know as educators, it's a little bit more difficult. It's easier said than done. I understand that, but it is also a way for you to take care of yourself. So that's one thing that I would say is part of self-care, is taking time for yourself. And then find out if your agency offers an employee assistance program. That's really important and helpful, and those typically are free for the employees if your organization offers that. So check into that with your HR department. So this is key, right? This is, you all, if you've been on an airplane before, you know that the stewardess up front are saying, put on your mask first before you help your child right next to you, your baby, right, that you're sitting right with. And you're thinking to yourself, I need to take care of this baby first. Now, you can't really do that, because if you don't put your mask on and you only have a couple seconds, you can't really reach to help that baby. You have to first get yours on as quickly as possible, and then you reach to get it on your child. And that goes the same when you're working with a child or in this profession and you're dealing with trauma. You have to take care of yourself. So all of this is about, again, that self-care, making sure that you're taking care of yourself, making sure that you know what you need in order to stay and be healthy and be in that front seat when you're working with these children. It's really important that you remain calm, emotionally regulated during challenging times, and become more consistent and safe, and leading to a stronger and deeper connection, even with your peers at work, so that you can be there for the children that you're serving. This is just a fun slide to remind us all, we're not perfect. We need to have permission for certain things. We need to know that it's okay to feel how you're feeling. And even for the children, it's okay for them to feel how they feel. We need to be kind towards ourselves as well as forgiving. Many of us are not very forgiving when we make a mistake. It's very important for us to do that. Especially right now, for many of us, self-care is turn the news off. Many of us can't handle the news anymore right now. So turn it off and be okay with that. You don't have to be in the know all the time. Sometimes it's not even helpful. It's also okay to let yourself cry. Sometimes people just need a good cry. I know I'll turn on a movie when I feel like I just need a good cry, and I know certain movies will make me do that, and I'll turn it on just so I can have that good cry. Sometimes we're going to miss the small things, and that's okay. And we need to be okay with that. And understand that, just as Kate said, we just need to breathe. We have to breathe through this. It's okay when people say take it one day at a time. At this point, take it one breath at a time and be okay with that. Again, we're talking about a self-care plan. It's important for you to identify and create your own self-care plan. And we'll have some ideas on here for you to be able to create one for yourself. Here's one that's, quick, easy for the most part. Some of them may be a little bit more. It's important to create balance. We can stay in our thinking brain by practicing regulation strategies. Some of these are included as focused breathing, pausing between activities, mindfulness, and grounding techniques. You'll see on here, meditation. Many people like to read books, just going and sitting in nature, drinking some coffee. I have a friend who, for her self-care is making a cup of tea and drinking tea. So it's what you like and what you think you can implement. Here's a couple more that are just 2 minutes of self-care. Nothing long, nothing that's going to take you a long time to do. Again, as I mentioned earlier, the Headspace app or Calm, those are nice. They all have like 2-minute quick meditation or mindfulness exercises. You want to try to engage your senses as much as possible. So it's either, feel, touch, taste, smell, or listening. So try to engage your senses. So just as Kay had talked about mindfulness, what scientists have found is that when you live in the moment, it gets you out of your head and it helps you focus on your surroundings instead of being wrapped up in your thoughts. You usually will feel better, happier, and less stressed if you're not wrapped up in what's going on in your head all the time. With enough practice, you'll also learn to better manage your thoughts and feelings so that you are in control of them rather than them being in control of you. And then Peter Bergman, who he had like a 5-minute end of day work checkout. And I thought this was helpful, especially right now when we're, all working from home, and not all, but for the most part, we're trying to balance between home and work and figuring out like how to wrap up the day. And it's, ask yourself, how did the day go? What successes did I experience? What challenges did I endure? What did I learn today about myself or others? Talking about who did I interact with? And then finally, asking yourself a question or plan on saying, what do you want to do differently tomorrow? So that you can set yourself up for success for the next day. Again, as Kate had talked about, building resilience, we need to build resilience in a trauma-informed system. So in our organizations, it's important for building resiliency as well. So we need to focus on prioritizing physical, emotional, and psychological safety in every interaction and every process. We have to avoid blame. We need to show grace and compassion. And now is the time for us to align and connect with others. We build trust by practicing intentional relationship building. We need to over-communicate and share as much information as possible. We know if we don't communicate enough, the trust isn't there. So we need to overly communicate to people. Remember that during times of crisis, people's brains tend to go offline or more towards the trunk. So over-communicating gives them that information that they need to keep going. Also, I want to encourage you to consider creating a buddy system. Again, it's that self-care piece so that you can make sure you have that peer support you need.
Thanks so much, Christina, for sharing some of those tips. I just want to be mindful of time and making sure that we have some time for the Q&A as well. So I just wanted to mention that while you're on this slide.
Okay, great. So it's important that as we discuss strategies for mental health, we also look at the racial equity and educational racial gap. And we had mentioned this during the panel as well. So it's just really important that we keep this in the forefront. And what we found was as we balance our mental health, external stressors, traumas that impact ourselves, students, families, and communities, we must also center our practice and approach around racial equity. Quality early childhood programs have the opportunity to address the racial educational gap. I did find a study, and unfortunately I didn't tag it in here, but it does talk specifically about Head Start and how it is helping bridge that educational racial gap. So I wanted to make sure I mentioned that piece of it. That is very important. So what can we do? It is providing the high quality educational programs, such as our Head Start are doing at this point. It's applying a racial equity lens. So not only that trauma lens, but also the racial equity lens. Be mindful of how institutional, interpersonal, or internalized racism is manifesting in particular situations, and how the students may be consciously or subconsciously responding as a result. Make sure that we're uncovering the structures, policies, and procedures that sustain unequal outcomes for students based on race. So make sure you're having these conversations with your administrators, among each other. Keep asking the questions, keep talking about it. Continue to educate yourself about race and racism. This is going to be the change as long as you continue to keep questioning, keep those questions coming. When you're also, it's really important that as you're exploring curriculum, ask yourself, whose story is being told through my curriculum? Make sure it's representative of all different races. And make sure you're looking at whose stories are not being told. And apply a racial equity lens when discussing disciplinary principles, opportunities for youth, as well as bringing in parent voice and professional development offerings. So I just wanted to end with that discussion because this is really important. This is really key. Make sure you stay curious to learn about the families you work with. Ask them questions. That'll give you a lot of insight into race and where your families are coming from. Approach all of their behaviors as an opportunity of inquiry so you can learn about their race and how things are done in their homes. So keep asking questions and don't be shy. That's it for me, Joy. I need a drink of water now.
Yes, please hydrate. That's my self-care tip for everyone, is hydrate also as well. Thank you both so much for sharing your wisdom with us and all of those helpful tips, the activities. I didn't know I needed to see Common as a Muppet, but I did. So thank you both so much for sharing those resources. And I just want to, point out that those resources will, some of those resources along with others that we've curated from the panel will be shared on the Tools for Hope website that I believe has been dropped in the chat. So please check those out there if you'd like to, test those out in your classroom, in your virtual classrooms, and for yourselves. So I'd love to spend about these last 15 minutes just asking questions to the panel that you've sent in. If you still have some questions that you have, please feel free to continue to send them in. But I'd love to start off maybe with you, Sarah. There's a question around any thoughts or tips on first steps to creating a resilience enabling environment. And that really can go to anyone, but any first steps as to someone who's thinking about creating a resilience enabling environment for their kids, what that might look like and what are some tips for that?
Absolutely. So as they touched on in the PowerPoint presentation, that connection and that relationship is really, really important. Day one, starting with forming relationships with your children, getting to know them, forming relationships with their families. As Christina said, like using that trauma lens is also very important. Shifting your thinking from, like she said, why are they doing this to me? Why are they doing this to the classroom? You know, what happened to them that is, you know, making them want to do this? Or that is, you know, this behavior, where is this behavior coming from? You know, I've seen a few times I've been in classrooms where I had to step in and help. A kid was having a hard time and he had like totally trashed the toy area, and the teachers were, you know, encouraging him to clean it up. They had to move on with their day. I came in to help. They're like, oh, you know, he's doing it again. And I sat and I started talking with him. And it turns out he was going through something at home and he was acting out. But if, you know, since I took the time to make that connection, we got to the root of the problem and we were able to start working with him. It actually ended up, unfortunately, being a CPS call. But like, so something like had seriously happened to him and he was trying to process it and he didn't know how. So taking those even just a few minutes to form that connection and start the conversation was key. So really the connection piece is so, so important. And like she said, instead of seeing them as attention seeking behaviors, think of them as connection seeking behaviors. That has really helped me when I tried to shift that thinking to become less frustrated and more, you know, empathetic and problem solving. And the behaviors decrease so much faster when you get to the root of what's going on.
Thank you so much, Sarah. And I don't know if any other panelists want to share any other thoughts on first steps to creating a resilience enabling environment. I really love that connection, switch from attention seeking to connection seeking, which you all have mentioned as well. I love that. It's a small switch, but language really matters, especially when you're trying to think about it in your mind quickly as to what that might look like.
I really like the question. I know Sarah said it, but when Christina talked about changing that question to what happened to this child instead of what's wrong, it invokes an empathetic response and a connection response. And working with both mental health and Head Starts, one of the things that I've noticed is that when there are what we would typically identify as aggressive behaviors, those behaviors usually come from some sort of fear or trauma. And so when that switch came, what is this child afraid of that they have to protect themselves from this? It just invoked a totally different response. And the way Christina explained how we can make that mental switch to turn on our trauma lens and ask those questions, but also what Kate was saying about giving children choice and opportunity. Right now, everything is just so restrictive. You can't do this, you can't do that. And those things are just repeated. So even the little opportunities that children had for choice and opportunity, they're even lower. And so if we're not intentional about that, they lose that. And then we see those acting out behaviors because of the tension in those restrictive areas. So that choice and opportunity, looking for those areas where we can encourage that in young children.
Thank you so much. We have another question, really thinking about parents and what are ways to nurture parents so they know that you're on their team and you're not at odds with them, especially in this virtual space.
So I think a big thing is just talking with them, forming a relationship, trying to use empathetic, and even with the children, you know, validating their feelings about things. I've formed some pretty close relationships with a lot of my families, and they feel comfortable telling me things, which is great. And it's so key to helping the kids, is just forming those relationships with the parents and having casual conversations with them, you know, not always just about, oh, what your kid, you know, did wrong in school today. You know, sharing those positive stories and even just asking them about their day. Really forming a relationship is really key to beginning that support piece.
And I also think it's important for them to know that, you know, they're their child's expert. So you need to rely on them for that piece too. They know their child. It might be the first time you're meeting with the child or the parent. So just making that connection that they are the real expert when it comes to their child is key.
I love the sort of idea of really sort of thinking about how you honor parents knowing their kids best and that they want what's best for their kids. But parents are also really struggling right now, right? And so I think all the things that we just talked about kids, I think, Christina, you were saying this, and Andrew, you were saying this, and Sarah, um, that, they all apply to parents too. So that when parents come in and they're frustrated with us, or they're acting in ways with the kids that we're sort of like, oh, and it might feel, hard because we wish it might look different or whatever. If we can sort of shift the lens again to, what is it that you need? Not just why are you doing this, but what do you need in this moment? How can I help you to feel calm? If you're frustrated sort of on pick up that, your little one doesn't want to come to you right away and walk out the door. How can I support and meet your need and respond with kindness and compassion and grace and help to regulate the situation in a way that lets parents know you're on their team, that you understand that things are hard, and give the support that they might need in order to sort of be in a better space too. Because, people are just really, really often doing the best that they can, but it can be pretty overwhelming.
Thank you all. Yes, no, I think exactly that. All of these tips that we've shared about self-care and taking care of yourself can apply to parents as well. And even on one of the slides that Christina shared around all those 2-minute self-care tips as well, parents and families are busy. So being able to share some of those tips with them as well is super helpful. Thinking about parents also, there was a question around how you might approach a non-judgmental conversation with parents about negative behavior changes, especially as we think that unfortunately there still is a stigma around mental health and how we might approach that. So I'd love to hear if there are any approaches to non-judgmental conversations with parents about negative behavior changes and how you might approach that or have approached that.
I think it's really just important for us to come at it as a place of concern versus judging. So if we, came to them and said, we've really noticed a little bit of a change in Johnny, and we're getting a little worried about what's happening, can you shed some light on anything that may be going on right now, where we can give them more support? I think it's just about the way that we come in at it, and making sure that we're not placing judgment on the parents. Really, that's who is going to be concerned that you're judging them. Is I'm the parent and you might be judging me that I didn't do something right. And that's really what we don't want to have happen. So coming in as a partnership versus something happened and you did something wrong.
I think it can help a lot too to sort of destigmatize, if you think, kind of like we were saying, practice the mindfulness skills at times when, things are going well. If we can talk about and have resources available for parents that talk about how kids might respond to stress, and really normalize, like, what, everyone is dealing with a lot of stress. So we're going to send home some materials that let you know how kids might show us that they're feeling stress or worry. And really normalize that in a way that lets parents know that this is part of what, we care about. We care about your whole child. We want them to branch out and learn and grow and learn new things. And we want to help them feel solid and safe and secure and have those sort of strong roots, knowing that if they're struggling with feelings, that this is a place where we can also help you find resources to deal with those hard feelings that might be going on. So really creating that environment that says, lots of kids are having hard times right now. And we know that lots of families are having hard times, and it's okay. We can talk about that. And if you're finding that your child is having a hard time at home or a hard time at school, we're here to offer some resources and some help so that you can really help your child to be resilient and to bounce back in the face of those hard times.
One thing to add to that too is if you're having like parent meetings or parent curriculum night, start intertwining some of these into those parent meetings or parent night. That way it's decreasing the stigma along with it. So that's going to be very important if we can start weaving in even the concepts about trauma and concepts about mental health. That's going to help destigmatize both.
And just to piggyback on, I was thinking about one of the things that Kate said about when you practice relaxation, like practice it beforehand before you need it so you can refer back. It's the same thing with having this tough conversation. It's hard to form a relationship around a difficult subject. So, making sure that that relationship is formed before there's concerns and before there's problems. So when that feedback is given, it's not like, oh, every time we talk, something's wrong, and right now, the time that we're in is kind of a great equalizer. Like, I just read an article that like COVID has touched like every end of, the world except for like 3 cities or something. And I was like, we're all experiencing it. And it is at different levels. But we are kind of like in this boat. We just got different boats, but we're in the water, like figuring it out. So we can relate that way, even if it's not to the same level.
Thank you all so much. I love that, building the relationship before, a concern does come up. So it's really a natural conversation. And I think it speaks to your earlier point, Christina, around partnerships, right? That this is a partnership and, you are your child's expert first and foremost, but we are here to support you in that. And how I really, really appreciate the tips about parent night and how do we build in that kind of language around trauma beforehand as well. So it's not a new concept to parents and families as well. So I appreciate that. So I just wanted to spend maybe 1 minute with this last question before we wrap up this amazing conversation. I honestly, as some of you already might have known, I'm very passionate about this issue. I could talk to you about this all night. But there's some, we talked a lot about how routines are extremely important. And there was a question around, what routines are most important to ensure to keep in the classroom that might have shifted from classroom to virtual, but what do you think is most important to keep within that routine?
I feel like it's hard to pick a most important, like the whole day is important to keep routine. Something we talk about too is not every day goes smoothly, not every day goes perfectly. So as long as you keep the same order of the day, because children that young don't really have the sense of time that adults have. So as long as you're doing things in the same order, that really helps. Like cleanup time was hard today. It took 20 minutes and, we only usually have 10 in our schedule. So you just, fudge the other stuff by a little bit, but you keep it in the same order. You don't cut something out because part of the day didn't go right, because that throws them off. Being virtual, something that we've been doing is we sing the same song every day at the start of our calls. So we sing the same greeting song every single day, and the kids have really picked up on it. Like I said, I teach infants and toddlers. So even my youngest little 5-month-old infant, when I sing this song, I kind of sway back and forth. And as soon as I start singing it, she just starts swaying and she looks at the computer screen and she smiles and she knows that our Zoom call is starting. So even something as simple as that is really important. And at the end of every Zoom call, I tell them to have a fantastic day and we'll see you tomorrow. So they know that it's ending. So even during our 15-minute Zoom calls, I'm still trying to keep some sort of a routine so that they have some sort of normalcy. And we always do our calls the same time every day as well.
Thank you so much, Sarah. And just being mindful of time. I can't believe we're already at the end of this amazing session. And I just want to thank our wonderful panelists. I'm applauding for everyone that can't unmute and applaud. But thank you all so much for sharing your wisdom with all of our early childhood educators and professionals. And thank you all that are joining for the work that you're doing in community. We appreciate you all so much. And I will take a note from Sarah and tell you all to have a fantastic day. And we'll see you at our next Tools for Hope session. And you can find those upcoming Tools for Hope sessions at the Tools for Hope website. And we hope to see you in our future sessions. But thank you all so much for joining and have a wonderful night.